guys, John McNamara, host, Running Vegas. We're talking local sports, business, real estate. If you guys like what you see, subscribe, follow us on Running Vegas podcast. Today, we got Mr. Co-host George Hernandez in the house, and we got a special guest, Dr. Leah Goedecke. Thanks for coming in.
Thanks for having me.
Yeah, we're excited to have you on. So tell us more about you, your story.
Yeah, so I'm a physician here in Las Vegas. Came from Ohio. My specialty is neuromusculoskeletal medicine and sports medicine. I did my undergrad at University of Arizona. Go Wildcats.
Wow.
Ooh, fun.
Yeah, so party school maybe back in the day. Not so much anymore.
Oh,
but,
really?
Yeah.
Oh, okay.
It kind of died down.
Yeah, okay.
Arizona State, I think it's like the party school.
Yeah.
Oh, okay.
That's where we went that one time.
Okay.
Yeah. I think he's thinking of.
I'm really bad with.
He's thinking of Tempe.
It's okay.
Yeah.
We haven't gone
okay.
to Tucson.
Okay.
Yeah.
Yeah, thank you.
I came out here for private practice initially, but also came out here for boxing, combat sports. So
Wow.
started off as an athlete myself, competed a little bit in amateur boxing and fell in love with it, fell in love with the community, lifestyle, and now I'm out here working amateur fights. So
Wow. That's really cool. And you just attended a conference I saw?
Yes, the Association of Ringside Physicians. So really good conference. It's organization under kind of sports medicine, and trying to unify all of the different sanctioning bodies, I would say, because each sport, MMA, Muay Thai, boxing, all have kind of their own rules, regulations.
Okay.
So they're trying to kind of unify it. So as a ringside physician, we can all kind of be on the same page and follow everything, and also to put fighter safety first.
Yeah.
Because, I say it's a gladiator sport.
Yeah.
At the end of the day,
Oh, for sure.
you're going to get hurt. That's the name of the game, is to cause your opponent to have a concussion or an issue. So there's a lot of controversy of being a physician sitting ringside
when we're mad at each other.
Yeah, sure.
guys do that in general. That's where it comes from. Okay? Females don't fight it out. Men do.
Yeah.
But we are very tough. The females tend to be a lot tougher
for
than
sure.
the
I
guys
believe it.
are, for sure.
Yeah.
I believe it, yeah.
But yeah, so they're trying to, we want to create the sport to be safe.
Yeah.
But we want to also keep true to the sport.
Right.
So there's a lot of controversy in being a physician because our goal is, health.
Yeah.
And so when you're in a sport, when the goal is to hurt the other person,
Right.
there can be a lot of controversy in that and deciding when to make calls and when to not. But at the end of the day, broken bones can heal, depending on where they are, 4 to 6 weeks.
Right.
But your brain is not like that. And so that's the most important thing that we talk about is concussions, CTE, TBIs, that type of thing.
Okay.
Yeah.
So what are some of the things to... Sorry, buddy.
I'm sorry, my ADD kicks in. Go ahead.
What are some of the things to prevent concussions?
So one is making the right call, right, during the fights when they're happening. You see it more in boxing because it's repetitive hits to the head versus MMA. Muay Thai, you can see it depending, you got slap, which a concussion is right then and there.
Right.
They get knocked out. You see that all the time. But it's a concern of second impact syndrome. How hard are these guys training in the gym, which we can't monitor that, right? Did they just get knocked out previously while they're sparring and now a week later they're in competition?
Yeah.
So
Right.
it's creating that honesty of, fighters being honest with us and then, creating, this is headaches, dizziness, nausea, vomiting. This is not normal. It is created normal within the gym. In the gym, it's like, oh, it's okay to be hurt. It's okay to be like this, right? I was there. It was like, my coach literally had me spin around on a bat to mimic dizziness and then put me in sparring. So I get the name of the game, right? We don't complain about anything. We don't say anything. Injury is normal. Headaches are normal, but it's not.
Right.
It's not in the long run.
Right.
No, it's not. I'm so glad to hear that you guys are getting safer because when I played football, I was getting cussed every single day.
Yeah, I was just going to say.
That was not a thing
That's
20 years ago.
now.
Yeah, that's clearly.
Can I give them context really quick, though? Because you did something personally to me, and everything you do is great, and we've had little conversations, but I had sciatica, kids, and I couldn't get into the spinal doctor, or I'm not sure what exactly he's called, but you did manipulation on me 3 times, and I remember the third time I went in there, my pain level was at 0. So it was like just craziness. So thank you for that, because it's like everything's doing way better now. And then just to give you guys context, kind of how we met too, which is kind of cool. And so my ADD kicks in, so I apologize. But so when I get like excited, so there was this rad picture we saw this, like that's not the one we use for Instagram today, but you're in the boxing ring looking at this boxer and you have heels on. I'm like, that is the coolest fucking shot ever. Yeah. I'm like, I love this. Like that should be framed. I'm like, it's cool. It's like just so empowering.
Yeah.
Like, yeah. So, yeah, okay.
So, so thank you for helping. I have sciatica too. You helped me too. You were referred by my mom. So.
Yes, and your mom is great.
Shout out to Kathy.
We do everything she tells us.
Yeah, mostly.
Yeah. I mean, that's where my doctor of osteopathic versus, MD versus DO, I'm a DO.
Okay.
And so DOs have a little bit of a different concept in that they believe the body can heal itself. Mm-hmm. So I would say it's a balance between modern medicine and holistic. We kind of sit in the middle. It's not just let's give meds to our patient. It's let's create this functional medicine. What can we do that your body can, to help your body get better, right? Yeah. Not just throwing meds or saying, okay, just do A, B, and C for every single patient I see, right? Everyone has their own mix. That's why I believe medicine is an art. And I think, looking at the biomechanics, just like in sports, is extremely important. Right. And I know you guys go to the gym, you do your stuff, your Pilates, and it's important to have that biomechanical functioning proper so you can fire muscles properly. And then you don't get that imbalance, then when you keep with that compensation pattern, that's where problems happen and you're overused.
Right. I had a question. I had a question really quick, just because time goes by so quick, and I was trying to articulate it earlier. So just bear with me really quick. So I would like to know, because we all go into a career thinking like a preconceived notion of what we think that title or career or position is going to take you in life. How has it been different from the time you went to school, you got out of there, and being in because we talk about it all the time, like the holistic route and the health route and all of that. How has your perspective changed since you went to school, came out, you're actually in the field, and you're like, oh, you know what, this isn't what I thought, or maybe this was, but this is what wasn't talked about. There's a lot of restrictions. There's big pharma, there's food, there is insurance companies, healthcare, hospitals, and all these other that are ran like businesses where you think they're all working together, but at times I don't believe they do.
There's a disconnect.
So, what's your take on that?
So
because you're actually in the field. What's the most frustrating? You can take it any time.
So I grew up with a dad. He's a physician. So he had his private practices, 2 private practices, and when I watched him practice, it was awesome. He had autonomy. He could do whatever he wanted. I don't feel like there was this huge overbearing insurance companies that were telling him he can't do this or can't do that. And back then it was like cowboy medicine. You can do a little bit of everything. You have to subspecialize in every little thing. And patients seem to have a very good connection with him and him with his patients. I feel the biggest thing, I came into medicine because I saw what he did and he loved it and his patients adored him, and I was like, I want that feeling. I want to be able to help people. I mean, they're like, well, why don't you go into nursing? It's still a little bit different. Bit different. And what they teach us in school isn't always applicable to what is in the real world. Actually very minimal, which is super frustrating. Medicine, like I said, is an art. It's constantly changing. We cannot do A, B, and C every single time with the same diagnosis. Everyone's different. Everyone responds different. There's so much talk more about epigenetics. Like, okay, you might be born with these genetics, but it doesn't mean that that's going to be the outcome for you. Environmental factors, stress playing a role. I think the biggest thing was after COVID is where people had such mistrust in medicine, and it was frustrating. Even as doctors were extremely frustrated. Although I was still in my residency, you had these hospitals that were ran by CEOs who've never been on the floor or never treated patients, so they didn't understand what to bring in and how to manage patients. And so doctors were super frustrated. We're getting overworked. We're trying to manage patients, and we have these higher ups that have never been in patient care. So super frustrating. Fast forward, now we have the CDC that's saying we need this, and it's mandated, and it's like, okay, but we have little research on it. So then you get that mistrust. And then we have big pharma where you put out medications, okay, but it's a side effect profile.
Right.
I mean, yes, there's a benefit and risk. I always think in everything, and that's what we have to weigh and have to tell the patients, right? I'm not going to give a 16-year-old a steroid injection shot for a tendonitis, okay? It's just long-term detrimental. They're going to get better. We got to manage this conservatively. Now we're talking a 70-year-old, okay, maybe. They're 70 years old, right? And
it's different.
It's different. So you have to think of all those different things, but what frustrates me is, one, insurance makes the decisions on what I can do with my management if I go through insurance, which is frustrating. I want an MRI. Oh no, they have to go to PT first. No, that shouldn't be the way it should go. They also don't pay well to the physicians, right? I mean, the misconception there is everyone thinks doctors are rich. No, I mean, half of us are in extreme debt. Private school. We're paying,
expensive.
Thousands and thousands of dollars, tens and thousands of dollars a year to be in school for this, and then we come out in extreme debt and stuck in a hospital system trying to make up until we're 50 years old. To insurance companies that I don't think do the patients any favor nor the physicians any favor. And I'm not saying everything's all bad with insurances, but the majority of the time we're fighting insurances. Okay? And so also then you have big pharma where it's like, we have studies on PRP, which is platelet-rich plasma and stem cells. We know there's not a big side effect profile to that. We know patients can do well with that. So why are we pushing steroids? Why are steroids approved, but this regenerative medicine isn't?
Ooh, is this true that we have to call it PRP here because we can't call it stem cell? Somebody said that, and I don't know if that's true.
No, they're two different things.
So
one is platelet-rich plasma, which is when your blood's drawn out and you're spinning it down, where stem cells are actually coming.
That's like the one you can do for the hair.
My toe, embryonic elbow.
So, and I think those treatments work way better, right? That's why I'm saying functional medicine. What we put in our bodies is so important. It's the brain-gut axis. It's a real thing, right? That's why we're switching to all these peptides and exosomes and everything, because what we put in our bodies and give our bodies are the building blocks to the rest of everything we have. But it is frustrating from the other standpoint, telling a patient, hey, you got to lose weight. It takes months to build a habit, 6 months to see a difference. No one wants to wait that long. Everyone wants this instant fix to the things that it doesn't work like that. Right? We have to change our diet. We have to change our habits. And yes, you can get off that diabetes medication. Yes, you can get off that hypertension medication. Now, I'm not saying every medication, because sometimes once you have so far into that disease process, it can be difficult. But let's start by not even having it because someone says our parents have it, that we're going to have it.
It's like obesity. I see that in certain cultures. Being Latino, it's like certain cultures, it's like, oh, you're just predisposed to, but no, it's because you're eating the same things.
Well, I think we get conditioned a lot, too, to just put a Band-Aid on it versus actually fix the problem, whatever's really going on. Like you said, it takes time and energy to actually fix things. So I got really lucky young because my mom, as you know, got me into holistic medicine. So it made me think completely different. But I understand the news and the media does not talk about that stuff. And it's taking a shot, whatever it is, and the commercials that are out there. So it's an interesting time.
So if you could change one thing about your industry, what do you think that would be, where it will change for everyone that comes after you?
I think of the red tape. We got a lot of red tape. There's a lot of red tape, and I feel like everyone's working against private practices. I mean, a lot of physicians are moving into concierge medicine where it's cash pay only, which I think benefits the patient and the physician. Now, if you're trying to manage someone with a lot of diseases, that makes it a little bit difficult if you have to end up being hospitalized at some point, right? That's where insurance kicks in. Pregnancy, that's where insurance kicks in. Other countries, that's not a problem. It's like $500, I don't know, in another country to get pregnant and be in and out. Here it's hundreds of thousands.
Right.
So
that math's not mathing.
It's not.
Well, I
think too, having being able to build more of the rapport with the patient, right? When I was working with both of you, I was in a different environment than what I'm at now, where I'm at under urgent care and occupational medicine. Different environment, right? When I'm in my more holistic, where I can do my hands-on and sports medicine treatment, do my regenerative medicine, it's a little bit different too with the patients coming in, what they want from me, right? Versus coming into a different environment where patients want other things. So I think that is a little play.
Private practice must be hard though, right? Because you already come out with a lot of debt, and now you are also trying, because we're essentially all clients, right? It's just like any other business, and then you have to acquire
Yeah.
all these people. Yeah, so
That's what burns us out,
it has
right?
to be challenging.
Yeah,
right.
we physicians. It's like, oh, we have such a shortage. Well, we get burnt out. The system burns us out. It's not fair. You want more physicians, treat us better.
Yeah, right.
and we'll be there, right?
Right.
We work extremely hard, right? I just finished my fellowship a year ago. I've only been out for a year, and you look at me and I'm like, look, I haven't even lived my life. I don't have kids. I've
Right.
literally dedicated my entire
like, how
life
am
to
I burned
medicine
out?
and school. So,
Yeah. So what would be something you say, like, let's say I come to you tomorrow, I'm like, you know what, you've inspired me. I want to be like you. I want to be a doctor. What's something advice you would give me that not some normal person, but somebody you wish somebody told you, like, hey, and maybe not like was going to derail you from that, but you would have taken it into a little bit more consideration and.
I mean, I think I was told plenty of times, but I was stubborn. I was like, I'm going to do what I want to do. And I feel like most people who do come, I mean, that's the type of personality you do need in medicine.
Right.
It's the endurance, it's the stamina, it's the grit, it's the, I mean, people are like, oh, you just have to be smart. No, smart is not going to get you far in medical school.
Yeah.
It's a grind. It's a constant, you're getting beat on, you got to get through this, you got to study. So I always tell people, I'm like, you can't quit once you start either. You don't want to quit. You've been so far, you got this. So there's tons of people like, oh my gosh, I don't know if I can do this, but you don't want to quit when you're that far in. You're neck in, you're deep in, and you're not trying to back out at this point.
Yeah. Do you have any recommendations for people out there that preventive medicine, anything they can be doing, supplements, anything you can recommend to folks?
Anti-inflammatory diet, right? Anyone who has any autoimmune diseases, I say clean your diet up. Diet is extremely important. Dairy's inflammatory. Get that out.
How about sugar?
Sugar, yeah.
I got
processed foods, no processed foods.
I know.
Skittles are the worst. They just banned that. Didn't they ban them in California?
Because of the color?
Yeah.
The
I'm
dye.
pretty sure they're banned.
I usually don't, but thank you for putting me on the spot.
I said nothing about you.
He is a strickler for sugar, strickler, and he's like, you're so many grams today. It's like, oh, here we go.
Shouldn't have 20 grams a day, man.
When I get a little sad, I go to gummy bears.
Well, you must be sad every day then.
I'm taking it one day at a time. I'm doing the best I can.
You're doing good.
I mean, it's the forever ancient thing we say, diet and exercise, right? Every doctor tells you that, and everyone's like, no. And it's like, yes. Diet and exercise. What is it? The 5 red zones or blue zones, the 5 places that have the longest living population. Mm-hmm. I can't remember what they're called. Is it red zones or blue zones?
I don't know.
We're talking about it, remember? And it's they get to a certain age.
100.
It was crazy. There was a documentary on it.
Yeah, and it's they get to 100.
I don't know what those zones are called. Oh, we did read a book
because Japan is the
Yes.
number one.
Yes.
They live until 100 something.
I forget, but I know exactly what you're talking about.
It's community.
Yeah, you're okay.
Yep.
Walking.
Read this book.
Yes, I know.
Community walking, loving the job that you do.
Yeah.
Eating healthy and eating to only 80% full. You
Right.
don't need to stuff yourself.
Yeah.
Right?
Ikigai was the book.
Ikigai?
Yeah. So, I mean, those I think are really important. And then, too, if you're getting surgeries or thinking of any more interventional type of medicine, get a second opinion. I always even for me, I tell my patients, get a second opinion.
Yeah.
It's not a one all see, all do all. A lot of times it's tunnel vision, and that's why it's hard because everyone subspecializes and they don't see the whole picture. The whole body works together. And I think, and I evaluated both of you, it was we look from head to toe. We figure out everything. What is contributing to this? It's mental too, right?
Yeah.
It's not just that. It's mental. It's how's your sleep hygiene? How's everything else going? You can't heal if you're not sleeping well.
Yeah.
So
that's for sure.
Yeah, sleeping is everything. It's
we just got our whoops, and that's been helping us with our sleep and our recovery.
Just accountable, him and I. Just with the sleeping. I mean, even with cancer, it's I've seen certain research, where they cut out sugar and alcohol.
Yeah.
And they start healing. It's just by cutting those two things out.
If you're not giving your body those toxins, you're not giving those building blocks.
Right. It's you're not feeding into them. So, yeah.
Do you have any books that you'd recommend for anybody to listen out there to help on their health journey? Because I know it's kind of big, because I think the most people, they just go to their doctor, they want the Band-Aid, right? So is there a good book out there or something, or a good podcast, something to read to kind of get people more on the holistic side of things?
I haven't fully read this book yet, but The Body Keeps Score. It's a book about pretty much understanding your body and the multiple different factors.
I can't sometimes. Oh my God. laugh a little.
But I think,
Anyway, sorry.
I think it's a good book for people who are in chronic pain, have fibromyalgia, some of those diseases that get thrown on you that you're like, okay, I look up and it's like no cure. Like, what do I do with this, right?
Yeah.
I think it's a good book for that. Or people who have had an injury and still haven't seemed to recover from it. Your body has PTSD, right? Just like you say PTSD from a traumatic gunshot right to the head, something happened traumatically. Well, your body can go through the same thing.
Yeah.
And so it's kind of learning to heal from that, from the inside out. And it is a big, your mentality plays a big part in, I believe, your pain tolerance and how your body adapts to things.
I have a question about, I'm sorry, I'm jumping on. I have like 100 questions for you, actually. That's why I was so excited for you to be here. So how do you build rapport with, because you're like, that's what's really important. That's kind of what's lacking in this industry. How do you build rapport with somebody that's coming into you with a certain situation? You only see them for 5-10 minutes maybe, and then they keep coming back. Or how does that occur? Is it because then they don't come back till a couple more weeks, right? And it's just...
Well, I mean, like
How
I
does
said,
that occur in your
in my
industry?
general, like when I was doing more of my osteopathic manipulation, I see patients once a week and I get to spend a half an hour with them.
Okay,
so
yeah,
it's
yeah.
easy for me to build rapport, right? And half the time, you know, people, docs never even touch me. And I'm like, you know, touch healing's a thing of like putting your hands on that injury and saying, you know, let's actually feel what's going on
believe that,
here.
yeah.
You're very physical too.
Yeah.
So
Yeah.
it's different. Yeah.
You know, there's no personal bubble as much as people would like.
Yeah.
But that's where you build
But it
that
works.
trust, right?
Right,
And I'm like, look, trust me, we're going to get better. And the patient comes in and it's like, okay, I've had really tough patients. And I've had patients that have cried to me because when I'm doing my treatments, sometimes they're painful, but they come back because they're like, this is
works.
better. This
Yeah.
is better.
I've been
And
there.
crying is part of the process sometimes of like, let this release go. You know, I think it's personality, right? I think sometimes med students have, it's not just book smart, it's being able to have a personality with your
Emotionally
patients. Yeah, and being exactly emotionally intelligent, being able to read the room when you come in, like, and not saying certain things with your patients, right? I'm not going to be the same way with an athlete that I'm going to be with my 80-year-old patient.
True. Right.
And I just feel like I'm able to just kind of read the room and build that rapport, find a connection. I'm lucky enough that I've experienced a lot and traveled a lot, and so there's always one thing that I can pull from my patients that I can connect with. Oh, you did this? Oh, cool. Like I did that. Like I used to do that, or I like that, or I enjoy that.
So like common ground.
Yeah, common ground with your patient. Try to, you know, not so much pull everything out of them, but find a common space where they can start to open up and build that trust with you.
Yeah.
And when they realize that you spend the time with them, even if it's 10 minutes, if I spend the time really explaining something to them, instead of just throwing something at them, then they realize, okay, she does care. She's trying to help me out and understand it, even if it's not what they want to hear. A lot of times.
Makes sense. That's like us with sales. Like, you know, every situation I tell our clients and our team members all the time is we can't just treat everybody the same.
I always wonder because with health it's different. Like, do people take accountability for not the diet, not the exercising, not the mental, right? Like with us, it's like, hey, you just want to financially gain this or that. But then you blame the doctor, right? And it's like, oh, but you're also not doing all of this at home, and you're hoping this one person fixes you. So I always wonder about that. That's why.
It is
Tread lightly, right?
Yeah, no, it's true. I mean, and I'll have that.
And everyone's so Sue happy here.
This
You know what I
is
mean?
Vegas.
Like,
This
how
is
many
very
times-
true.
Yeah,
Well, that's
it's like that's why only in America.
Yeah.
But go ahead.
No,
okay,
you're
he's
very.
smirking, I'm talking a lot.
No, you're very right. The amount of times patients come in and in the workman's comp world and be like, I have a lawyer, and I'm like,
There
okay,
you go.
there you go. Right, this is
We
going
do
to take
too.
10 times longer. The lawyer's not a doctor, but okay, all right.
Awesome.
But yeah, I think building that rapport is just like, I don't know. I do think it takes a certain personality.
Yeah,
And not everyone's
to
going to
kinda-
like you, but you know, you just kind of like, here, I'm at the end of the day,
They're
we're on
respecting
the
enough to trust you.
team. We're on the same page,
Right.
We're trying to be on the same page. And it is taking accountability, right? Telling someone to stop smoking over and over is not going to do anything. They're just going to get mad at you.
Right.
So I tell them, like, look, this is what's going to happen if you continue to do this.
Right.
So let's
Cause
like,
and effect.
you know, and again, I give them more outs than just one, right? It's not,
Right.
here's just the med for this. Okay, we could do A, B, C, D, E, F, it's like
Right.
all these different options. So if you don't like that, let's try the next one. It's not just let's throw a pill at this and see how this works. So I think also giving your patient options is another way, because
Yeah.
not everyone's going to want the modern medicine, right?
So I have a question. So what is something that you've seen right now in your field where everybody's on this health craze, especially like the younger generation? What are they? We're millennials. What's
Yeah,
the
they're not
younger-
like drinking as much. Seems like they're more health
what's
conscious.
like
But that's because of COVID.
That is true too. Yeah, that is. So
and
what
I don't think they can afford to go out
Everyone
and party.
turns 21
No, none
during
of us can
COVID.
afford to go out right now.
Especially not in Vegas.
We've all been in the last 3 years. We're all in the same boat. No, but what's a healthy, what we perceive to be as healthy, a myth that like you can
Good
debunk, whether it's like
question.
kombucha or maybe it's like do this, like everybody's into cold plunging all of a sudden, or the saunas, and we do
Corona
all
Lights.
of it just here, like Corona Lights. It's like what's something
Coffee,
that
they
it's
know
like
it's a cup a
everybody's
day,
doing,
or-
or like it was almond milk, but then it was like almond milk because they're
Now
really
it's
good
coconut
soy
milk.
so what's one
Microplastics and
I believe in the
don't get 'em
microplastics.
started.
Oh no!
Don't
Don't
get
get
'em
me started on microplastics. I'll have like a whole hour of
I
it.
know. I don't know. It's hard because there's still so much research being done on things, and then knowing what's bias and what's not. Right?
True.
A pediatric just I can't even remember her name. Pediatrician put out a study, and the CDC took his license away because he did a study on vaccines for kids.
But that's
Okay.
I could see.
And it was like,
Of course.
unvaccinated kids versus vaccinated kids, and where you look at the vaccines, where is it that they have the studies where, okay, if you don't get vaccinated, what happens? Are
Right.
you always going to not get that disease? How's your immune system? So this guy kind of took on the study of like, are these kids immunocompromised after receiving the vaccines, or are they
Right.
not? So it's just going based off of the research. How many studies can we get from it? Everything in moderation is okay. Too much of it is
Right.
a bad thing of anything, even if it's good.
Right.
So sitting in a cold plunge every single day is not good for you.
Right. I saw a
So-
study on that. How your body stops doing what it needs to do to cause itself to like become less inflamed. Yeah.
So, it's just trying to get a little bit of everything and what fits best for your body, right? I can't intermittent fast for the life of me.
I can't either.
I
No,
will
no,
literally
don't pass out.
Pass
be
out.
hangry and just get, and yes,
No,
you
he
have
almost
to,
faints.
yeah, and you have to, they say you have to build up to it. You have to build up to it. And I'm like, okay, but also you're causing ketoacidogenesis, then you're breaking down muscle tissue, and, your brain needs glucose.
Right. Yeah.
And so I'm like, okay, so there's
So
tons of
everybody's
studies. like-
body's different, yeah.
Everyone's different. So I don't think, again, there's not a formula that fits everyone.
Yeah.
Right.
There are things that are definitely bad, vaping and smoking. We know that
Right,
for a
right,
fact.
right.
Bad, right?
Yeah.
But can we say eating a couple Skittles a day is going to kill you?
Yeah.
I don't
Thank you
know.
for that. According
I
to
don't
John,
know.
I'm gonna die because of it. But
He was literally eating Skittles on the way here. I kid you not.
Are you not going to be just more exposed to just what we're sitting in this room full of lights right now?
Right.
Exposure. Is that just as bad as eating
Right.
a couple Skittles?
Right. Yeah, you just don't know.
Washing the clothes with certain detergents, is that just as bad as eating
Right,
a couple
and then
Skittles?
and then it gets into your
That
body.
is true.
Or Nevada water, drinking that. It's like,
Yeah.
okay.
It's endless, yeah.
Yeah.
It really is.
Is there any technologies coming out that you're excited about, or AI? Because I know everything I've been hearing is AI, and the medical field's going to be huge.
It's a hit or miss, right? The
Okay.
biggest thing that I'm seeing a lot of AI in the field that I'm working in is the radiologist is using AI, and I'm not a big fan of it because they're still training the AI system, so they're still missing a lot of things, and they're
Yeah.
forgetting to proofread what they're sending. And so I'm reading these, and I'm like, okay, well, you missed this, you missed that. So I think AI can be as a tool, but I don't think it should be the all. I still think that we need to
agree.
run back and look at proofread it, right? We're still training these AIs, and at the end of the day, I don't think they're going to be able to replace, especially what I do, where I'm hands-on.
Right.
Right.
Yeah.
And like I said, every person is different. Are you really going to be able to put in every little thing about yourself and it's just going to spit out exactly what you need?
Yeah, that's true.
I don't think so, because you're forever changing and things are
Right,
changing.
because everything's data and it can't be the same thing twice.
Yeah. So I think there is a benefit for it in medicine, especially when it comes to the EMRs and us having to do notes, because I hate doing notes. I think it takes away so much time from my patient, and me having to do all of this, it's
Yeah.
frustrating. That's why when you're a private practice and you're not under insurance, you don't have to worry about all those notes.
Right.
But you also want to, you have to do your legalities and make sure, if someone comes back and
Right.
tries to sue you.
Right.
Right.
You have.
So it's a little frustrating with medicine. It is political sometimes at the end of the day, which you don't
You
like.
have like
but
a little note taker as you're doing like.
Sounds like
yeah,
CRM.
which you have to pay extra for.
Yeah, well, but all the businesses are the same. You
Yeah.
gotta get your own clients. You
Right.
have to know what you're doing, right? It's like, yeah.
For sure. Well, when you're not working, which seems like all the time, what do you do for fun? When you have a little free time?
I do like the gym and training. So I mean, in my free time, I do my boxing.
Yeah.
That's my free time is working the
Because
boxing
I feel like
events
you
and
could beat
MMA
me up.
events.
Because I'm not a good
Oh, you
fighter.
could beat us.
But
I think you could beat us both up.
Well, because I wanted to do boxing at True Fusion, and I know there's nowhere near to what you do, but it's just this exercise.
it's
but
boxing
I'm like,
fitness.
Yeah,
It's still hard.
But I'm like, yeah, it's.
But I mean, yeah, I'm really big into fitness. I stepped back a little bit just because I'm doing so much. But
Yeah.
I mean, boxing's still my passion and still what I love doing in my spare time and being outdoors. I'm a big outdoors person. Used to ride horses when I grew up. So grew up on a ranch.
Yeah.
Oh, cool.
Right. So love being outdoors. Love traveling. Studied abroad in Spain. So I mean,
Nice.
medical missions. Love, again, still
Yeah.
a lot of dedication to what I do in my job, but
Yeah.
right, that's what I'm saying is you got to be passionate about your job and what you do because then it doesn't seem like a job
Yeah.
at the end of the day.
So what's next for you? What can you expect from you? What are you hoping to achieve? What are you trying to
Goals.
accomplish? Goals, aspirations, manifestation.
I mean, I still want to push the bar moving forward in combat sports, right? Creating a very a healthier environment for the retired fighters, right? They don't get the care like the NFL does or the NBA, and they're putting even more on their bodies than they are. And I'm with a few. The Ring of Brotherhood is one of the organizations I'm with to help fighters, after retirement or when they retire. Like they have all these injuries, but there's nowhere to go.
Right.
And nothing, so being able to create a community for these guys after the fact of fighting and putting their
Yeah.
bodies through all of what they're doing. Like I said, I just love that community. It's a lot of inner city kids, low income areas, they're going into boxing and they're creating discipline and learning leadership and teamwork, and you go into those gyms and it's just a community, and I think
Right.
it's amazing
Sometimes
feeling.
what they lack in those communities at home. So yeah, it's great.
Yeah, that's
So-
great. Well, that was like one of the quickest pods ever.
I had 10 more questions.
We want to thank you for being on. Thank my co-host, Mr. George Hernandez. Guys, this is Running
I
Vegas.
didn't read your
Take
questions.
care.
I knew I had so many.